Tori's an internal medicine and pediatrics physician with Gillette's Complex Care Clinic. Tori's been with Gillette just shy of 1 year, and during this time, she's worked endlessly to advocate for her passion, which is transition.
Thank you, Rhonda. And thank you everyone for coming. I'm so excited to talk to you about transition and how we can really start creating this very important culture at Gillette to help serve our patients. Debbie and I have no disclosures to disclose today. And our objectives are that you will, 1, know what transition is, 2, understand how complex it is, and 3, leave with a toolkit so that you can start implementing transition into your practice, into your department today. So just so everyone's on the same page, definitions. Typically when transition gets brought up, what people go to in their brain is changing from one provider, so a pediatric provider, to an adult provider. And that actually is called transfer. So when we think about transition is transfer plus everything else. So it's the skills, the processes that we are learning and developing in our patients and our families so that they can successfully navigate an adult model of care. We all know that there are patients that have an adult doctor that aren't thriving. That is not a transition. We want them to get to adult care and then really thrive once they're there. So my interest in transition really started when before I was a medical student, a college student, I was a PCA for one of Gillette's patients with SMA. And it was through this experience, she was in her early 20s, and really seeing the struggle she was going through and becoming an adult, that I got interested in this population. And it's why I chose to become an internal medicine and pediatrics physician, affectionately known as MedPeds. And it was during that experience in my residency that this even got solidified further. So I had my continuity clinic down at the Fairview Egan Clinic, and I actually worked there for a year after I graduated doing MedPeds primary care. And during that experience, I accumulated several Gillette patients who were in this transition to adulthood age and really fell in love with it even further. I also had the opportunity to work at both regions and as an attending as a hospitalist at the University of Minnesota, where I got to experience patients from Gillette having their first adult admission. And this was really eye-opening in terms of, 1, understanding the patient experience, how terrifying it is and how much there is that is so different from pediatrics. And it also gave me the insight from being the attending of learning about how little our residents really learn about complex childhood illnesses as we age, and how nurses and the system is just not set up for patients to be successful. And ultimately that led me to this job here at Gillette, which has been awesome. My practice now is in the complex care clinic, and I see about 40% of my patients are referred for some sort of transition related question.